Hey everybody, sciatic, right? So on Tuesday's Tidbits today we're going to be talking about sciatic pain. Sciatic pain affects a lot of people, and one of the best things you could ever do to help treat sciatic pain and low back pain is chiropractic. Hands down, research study came out, 70 to 80% of people went through chiropractic care as opposed to any other therapy. That includes massage therapy, physical therapy, the medical approaches, receive better long-term care and pain relief than any of those other modalities through chiropractic, okay? So go to your chiropractor if you have sciatic or low back pain. Now, make sure you understand what the sciatic nerve is, because I've had patients come in and they say they have sciatic nerve pain. I ask them where their pain's at, and they go here. That's not your sciatic nerve, okay? Your sciatic nerve runs from your low back all the way down the back part of your leg to just below the knee, and then it starts to wrap around the front part of your leg and the front of your foot. Okay, it's involved with L4, L5, and S1 nerves that come out of your low back. Okay, why is this important? Because if you have pain on the top part of your thigh, in the front, or the side of your upper thigh, that's not sciatic pain. Okay, those are going to be different issues. That's going to be things like L1, 2, 3 issues, myalgia parasitica. Okay, lateral femoral cutaneous nerve entrapment. Those are all your upper thigh issues. We're talking about sciatic, down the back part of the leg. It wraps around to the front part of your lower leg, okay? Now, what causes sciatic nerve pain? Inflammation, muscle entrapment, disc herniations, disc bulges, spinal stenosis, tumors, degenerative disc disease, degenerative joint disease. All those things can be issues that cause that sciatic nerve to flare up. What is one thing you can do at home to help this without going in to see anybody? A lot of times, you can help it with a piriformis stretch. Okay, piriformis, P-I-R-I-F-O-R-M-I-S, okay? Google piriformis stretches and start doing some of those. Piriformis is very important with your sciatic nerve because your sciatic nerve runs right underneath that piriformis muscle. Your piriformis muscle attaches by your tailbone and sacrum and wraps around your hip, okay? And when that muscle decides to tighten, that's going to tighten right around that sciatic nerve, okay? So you want to make sure that piriformis isn't putting pressure on that. That's called a piriformis syndrome, okay? We need to stretch that piriformis. I would not stretch hamstrings, okay? That's where you just bend down and touch your toes. A lot of people do those. And sometimes that causes your muscles to keep tightening up in the lower part of your back and in the back part of your leg and causes adverse weakness where you don't want it. And that can cause instability and that sciatic nerve to stay flared up. I've helped a lot of people by telling them just not to do hamstring stretches. Okay? What do you need to do aside from that? You need to do some hip flexor stretches, which is going to be your runner type of stretches. You're stretching out these quads. Make sure the leg stays in and start to pull this leg back. Okay? Lunge stretches. You can Google hip flexor stretches. Okay? Those will start to stretch those hip flexors out, and we get a lot of relief with that. Massage can be beneficial. Strengthening, core strengthening things, exercise can be beneficial. Vibration therapy, which we do a lot here in our office, is really beneficial. Okay, you go to a good chiropractor or a functional neurologist, and they'll assess, they'll diagnose sciatic. If you don't start seeing results within a few weeks, you might need to go get an MRI because there could be something putting too much pressure on that nerve, like a disc herniation that needs surgical intervention. Or you need cortisone to knock down that inflammatory cascade, which that's like our last resort. We don't want to do that, but it can be very helpful in those extreme cases, okay? So if you have pain that's not getting better with the stretches, or it's better but it's not quite going away completely, get in here, okay? Or get into another chiropractor who knows what they're doing with the sciatic nerve. Get into a functional neurologist who knows what they're doing with the sciatic nerve. And they can really calm those things down. Sometimes muscle imbalances are a big factor, and you need to know how to assess those, which we do, okay? FoldAFamilyChiro.com has some information on there. Give us a call, email us, 507-425-0025. Ask us any questions that you have about sciatic nerve. Let us know if you need us to come in and assess and get you the best care that we can. And like I said, a lot of people get a lot better with a few things that we do here. Thanks a lot. That's sciatic, and this is TJ's Tuesday Tidbits. Next week, I think we're going to talk about bedwetting. We've had a few people asking about that. So if you're interested, come on in and watch that video, and we'll see you next week.